This interview includes detailed discussion of surgical procedures and personal health experiences. It is intended for adult audiences. Parental discretion is advised. Cheryl offers a detailed account of her hysterectomy journey, and it is not intended as medical advice. Please consult your healthcare provider for diagnosis or treatment. Scan the QR code or visit pubhealthtv.com for educational links and interview topics. Hello, everyone. I am Arian Lillard Green, the host of Take on Health, and I am excited to meet with our guest today, Cheryl Bolt. And Cheryl's here to talk to us about her experience having a hysterectomy. We're certainly appreciative of her for sharing her story, which is a deeply personal story. But Cheryl says that there are things that she thinks people need to know about the procedure. This is certainly a topic that we want to highlight and talk about. Cheryl, thanks for being with me on the show, Take on Health. And tell us a little bit about your journey to a hysterectomy and anything else that you feel is important for the viewers.
Sure, sure. A little bit about me. I am 56 years old, um, and I am now 15 months post-op from a full laparoscopic hysterectomy, total hysterectomy. I've had 3 children. One was born with forceps delivery, and 2 were C-section deliveries. That is important to know uh, because my uterus was adhered to my bladder with scar tissue. I found that out after my second C-section, where the doctor had to go in a different way and cut in a different area than my first C-section. So I had a hysterectomy 2 days before my 55th birthday. Leading up to it, I was very healthy. At age 53, I had an abnormal pap smear and was sent to a gynecologist. My regular primary care physician would do my annual pap smears for years. I didn't have a gynecologist that I went to. I went to the gynecologist. They did a pap and it still came back abnormal. So they wanted to do what's called a colposcopy. A colposcopy is where they scrape away cell tissue from your cervix. Rather than just doing a swab, they do a scrape of tissue to test. That came back with atypical squamous cells, which are precancerous cells. My gynecologist, after the colposcopy, wanted to do a LEEP procedure. A LEEP is a loop electrosurgical excision procedure where they cut away part of the cervix, hopefully removing the tissue that has those atypical cells. So that's the first procedure. 3 months later, I went back for the follow-up, had another colposcopy, another scrape, and it came back that not all of the cells were removed and they'd actually increased. So I was then sent to a gynecologic oncologist. I didn't know that there were all these different types of gynecologist doctors, which I'll get into another one that I had to go to afterwards. So that's when I was referred to the gynecologic oncologist. My first visit in to him, I was referred to him to discuss a hysterectomy. So I went in fully expecting him to say, okay, well then let's move on. You have these atypical cells. He looked at me and he said, "You're the healthiest person that's walked into my office today. You don't need a hysterectomy. I want to do another LEEP." I really wish he would have just gone ahead with a hysterectomy because he did another LEEP, taking an aggressive amount of my cervix, cutting that away. When I went in for a follow-up, my cervix had so much scar tissue from that second LEEP that my cervix closed. The choice I was given, he could not get to the cervix to do another scrape to see if all of the cells were removed. So I could go into the OR to remove the scar tissue so that they can then test to see if the leap was successful, or I can go ahead with a hysterectomy. So that's why I wish I had just gone to the hysterectomy because that just prolonged everything that I was going through. And that is when we scheduled the hysterectomy.
Let me pause really quick because you said a
Mhm.
lot in terms of how the journey began and the mystery that people often experience trying to figure out a diagnosis and the best route
Right.
to get restored to a reasonable portion of health. What your emotions were during this journey and this mystery solving.
It was a lot of anxiety and a lot of uncertainty. I was a very, and I still am, a very physically fit person.
Yeah.
The first time I met my gynecologist, actually, she called me tiny. She's like, "You're so tiny." I exercise 5 to 6 days a week. I had gotten to a place where I was very happy with my body after many years. Down to a size 4. I had lost 20 pounds just 3 years earlier, and kept it off. I was anxious about how this would change my body. I was not I was still premenopausal when I went into this, and I didn't know how this was also going to change my body. You are premenopausal until you have had 1 year without a period. That 1 year anniversary of not having a period is when you hit menopause, and then everything after that is postmenopausal. I was in the middle of that 1 year, so as far as I knew, I was not experiencing all of the menopausal symptoms. I've come to find out later I was experiencing a lot. But that's that's a whole menopause is a whole nother
And
discussion. I was anxious about how it would change my body. I was anxious about recovery, about getting back to being able to exercise at the level that I was exercising at. But there were lots of other things that I needed to know about that I was not told beforehand as
okay.
well. Yeah. And I can go more into that. One thing that I know after the fact is that I was not counseled enough about whether or not to keep my ovaries. There's different types of hysterectomies and what they take. They could just take the uterus and the fallopian tubes, leave the cervix, and leave the ovaries. They can take the uterus, fallopian tubes, and cervix, or they can take it all, including the ovaries. I have obviously needed the cervix removed because that's where the bad cells were. You can't just remove the cervix. The cervix is connected to the uterus. That all has to come out. When I had the appointment with the gynecologic oncologist, and he said, "Okay, well," after the second leap, he said, "Well, these are the options. You probably should have the hysterectomy." I said, "Well, what about my ovaries?" He kind of paused and he's like, "Well, at your age, they are still giving off a little bit of estrogen. Maybe we can keep them." I'm like, "Okay." So I went out of that thinking that I was going to keep my ovaries. Did not research it anymore. A few weeks before my surgery, I got the notification through my file, whatever, that what type of surgery was scheduled. And in it was an oophorectomy. I had no idea what that was. That's the removal of the ovaries.
And you found
So I
this out at the time of the surgery.
3 weeks before, probably about 3
Wow.
weeks before.
Okay.
So 2 weeks before, I have a consultation. My pre-surgery consultation was actually a telehealth visit with a, NP at the office. It was not with the doctor. So she went over things of preparing for my surgery and my recovery and various things. And so I said, "Why is it showing an oophorectomy when I was told that I would get to keep my ovaries?" And she's like, "Oh, well, you can research that before the surgery and let him know on the day of your surgery whether you want to keep your ovaries or have them removed." That was the counseling that I received.
To research on your own, to inform
Yes.
yourself about such a
Yeah.
big procedure.
Yeah. So I did. I looked it up. I was in a high stress, high anxiety time. I was weeks away from a major surgery. I didn't know what was going on. Removing the ovaries, the risks are, let me see, I have a higher risk of osteoporosis and a higher risk of heart disease in women when the ovaries are removed because that is your producer of estrogen. But at that time, I had also joined a Facebook group, a hysterectomy support group. And I learned so much. I learned so much more from this support group from women who had had hysterectomies, preparing for hysterectomies in their recovery years after their hysterectomy than I did from any of the doctors that I spoke with, doctors or nurses. I did know that some ladies, years later, 1, 2, 5, however many years later, would have a second surgery to have their ovaries removed because of growth on their ovaries, cancer, whatever. So there was a risk in keeping the ovaries in complications later and a further surgery later on down the road, or the possibility of osteoporosis or heart disease. So I discussed with my mom. I knew that she'd had hip surgery, back surgery. I wanted to know if anything was because of osteoporosis, if she was experiencing bone degeneration. That was important to me. And she said, actually, no, she just had osteopenia. And before her back surgery, the doctor was very surprised at how strong her spine was. So she's like, so don't worry about the osteoporosis risk. And she advised me, get it all taken out. So you don't have to worry about anything down the road. That was all that counseling that I got about keeping my ovaries.
So
After
you
the
had to be
fact,
your own investigator.
yeah. After the hysterectomy, when I saw my pathology report, my ovaries were pink and healthy. I should have kept my ovaries because I believe that has caused extra complications afterwards because everything was yanked out. And even the small amount of estrogen that I was still producing at the age of 55 was needed, was helpful. You can tell your doctor beforehand. And when I was in pre-op and the doctor came in to talk to me, he said, "Okay, what are we doing about your ovaries?"
You make that decision.
Yeah, yeah. He said, "What are we doing about your ovaries? Are we keeping them or are we taking them?" And I told him, "We're taking them." So
What would you have liked to have heard in that moment?
I would like to have heard, and this could have happened. I have heard of women that their doctor has told them, "I will go in if your ovaries look good, we'll leave them." There's also been women that I have read that there was a cyst on their ovary. They removed the cyst, the ovaries stayed. Let the doctor, while they're in there and they can see if there's any reason to take the ovaries, you can tell them, if there is good reason, then you can remove my ovaries. If there is not, if they look healthy, if it looks like I can keep them, then I would like to keep them. I did not know that. So that's one of the big things that I should have been counseled on better. I also should have been counseled on what will be done afterwards as far as estrogen goes, because everything was being removed. You need estrogen for so many different things. There is a lot of talk about that, especially now. The menopause talk, postmenopausal talk right now so much more than it was even just 5 years ago. I should have been counseled about that and known what I was going to be doing afterwards. There's vaginal estrogen, there's oral estrogen, or you can have a patch or a cream. Also, complications that can happen after a hysterectomy. A major thing to know about is prolapse. It was not discussed with me at all.
Can you explain what that
Your
is?
your pelvic region consists of your bladder in the front, your uterus and your vagina, and your rectum in the back. And they're all stuck in their, uniform, I guess, like bookcase, like books. You can think of them like books on a bookcase. Prolapse is when your vaginal wall, your pelvic floor, is weak and any of those organs fall into your vagina. So, bladder prolapse is when your bladder is bulging into your vagina. It's out of place. Uterine prolapse, some women have a hysterectomy because they have uterine prolapse. The uterus would be your uterus is bulging down into your vagina. So there's rectal prolapse and there's rectocele, which are two different things. Rectocele is when your rectum protrudes and your vaginal wall is too weak to hold your rectum in place and it bulges into your vagina. A rectal prolapse would be more of the intestine bulging in. I had never heard of these before. After my surgery, I had several complications. I had a reaction to the adhesive on the Steri-strips. I had blisters form. I called my doctor's office after hours. And mostly, this is another thing that I wasn't told, and most ladies don't know. You can call your doctor's office at any time, and on the recording is going to be instructions for after hour calls for a call center for a doctor to call you back. You need to know that after surgery. No one told me. I remembered from when my children were younger, and I did that a couple of times with my pediatrician's office. So it was after hours, and I called. I I had a doctor call me back a half hour later, told me to get in the shower, remove those Steri-strips, and it was an allergic reaction. That was to loosen the adhesive to get the Steri-strip off.
Um,
You couldn't just like rip off the I found out it was a bad allergic reaction when I went to an allergist in the past year, and I have an allergy to rubber, which can be in adhesives. And then I also had a fever. And in the discharge papers that you're given when you leave the hospital, it gives you a list of things to watch for and to contact your doctor if it happens. And a fever is listed as one of them. It doesn't tell you, and no one tells you why it's dangerous.
mhm.
So I waited like 24 hours. I did eventually, I called my doctor's office and got the call center and had a doctor call me back again. Those doctors that call you back, they're the ones that are at the hospital for their shift and part of the medical team for that doctor's office. I found that out because I had to go to the ER. And one of the doctors that came to see me, she's like, I know I'm the one that talked to you on the phone. A fever is a sign of infection. Within the first 10 days or so after, you have to be watched carefully. You have to watch for infection, for signs of infection. I didn't know that. I was taken in for a CT scan and they found a hematoma. By the time I got to my room, they had not given me Tylenol the entire time. My fever was up to 104. And they watched, that was the Sunday after Thanksgiving, actually. So it was a holiday weekend. But they watched me very closely that night. They said if I had waited much longer, then I might have gone into septic shock. That would have put me in ICU. But that's why it's important. if you have a fever, to
Absolutely.
contact the doctor right away. Um, Back to prolapse. I found out about prolapse because about 8 weeks post-op, this is very personal and it may be strange to share for some people, but I'm going to get very descriptive about my symptoms and about what happened because people need to know.
Absolutely.
Um,
Thank you for that.
I was about 8 weeks post-op, and I was in the shower cleansing my vaginal area, and there was protrusion. I freaked out. I didn't know what
Mm,
it was.
scary.
I pushed it back in my vagina, like kind of in and over.
Mm.
I immediately released gas. When I got out of the shower, I had a huge bowel movement. Called my doctor's office when they opened. The NP called me and said that she wanted to see me later that day. She did a vaginal exam and told me that I had a rectocele. Rectocele is one of those prolapses that I explained. It's a vaginal wall prolapse where your rectum can bulge into your vagina. But also, your stool can get misguided if your vaginal wall is not strong enough. So the stool gets misguided. I was told to make an appointment with a urogynecologist, another type of gynecologist. A urogynecologist is more specialized in treating things like the rectocele.
Mm.
So my visit to the urogynecologist confirmed the rectocele. There's a series of things that can be done there. And one of them is pelvic floor physical therapy. Pelvic floor physical therapy also helps treat urinary incontinence because what it does is strengthens that pelvic floor. I have heard of some women that went through pelvic floor physical therapy before a hysterectomy in order to strengthen their pelvic floor to and that assists in recovery later. Something else I should have been told beforehand. I probably would have done it because after having 3 children, I did have some stress incontinence. Stress incontinence is peeing a little when you laugh, cough, sneeze, when you're doing jumping jacks, things like that. I had suffered from that for years. It wasn't too serious. But pelvic floor physical therapy, I think, has become more mainstream in maybe the last 10 years or so. I had never heard of it before. If I had, it would have been great after my 3rd child. Now people are doing it after childbirth to help strengthen their pelvic floor after childbirth.
And where did you hear
Um,
about that option to do that or that it would be beneficial
um,
to you?
Actually, the first place that I heard it was that hysterectomy support group on Facebook.
How important are these support groups from people
Yeah,
who have these experiences and share these stories, which is why we're doing this. Thank you.
exactly, exactly. When I went to the urogynecologist, she said, "Yes, definitely. Do pelvic floor physical therapy first. We love doing Pilates, that helps strengthen the pelvic floor. The next step after that is something called a pessary. Pessary is spelled Pessary. And then after a pessary, if that still does not help with the symptoms, then there's a rectocele repair surgery. So I went through pelvic floor physical therapy for how many months? 6 months. But during that time, my vagina didn't feel right, didn't feel normal. I went in this with a normal vagina. We'll
Mhm.
just say that.
Mhm.
I felt that there was extra skin. It was looser. I would be doing vaginal checks in the shower every day to make sure nothing was bulging into my vagina.
Sure.
Um, my mental health has gone through a lot. I was still feeling abnormal. Well, with me, because I felt like I never knew when there was going to be bulging, then I was extra tense. I couldn't relax. It was kind of a catch-22 where I needed
Mhm.
to relax, but I couldn't because I just felt that I needed to support. So that's when I finally said, "Okay, let me try the pessary." Went to my gynecologist to get fitted for the pessary. I could have gone to the gynecologist or the urogynecologist. The urogynecologist had access to more different kinds of pessaries. My gynecologist just had one type of pessary that she fit patients with. Um, and think of a pessary as a diaphragm you could take in and out. A pessary is just a round item that you can take in and out. You can leave it in. My doctor said she had women that just leave it in and come every 3 months for her to take it out and have it cleaned. I'm like, but you're not supposed to have intercourse when you have the pessary in. I'm like, well, that's gonna work. Yeah. So when I went to get the pessary, I cried in her office because I was so frustrated that it came to the point that I needed to do something like this. But she told me to think of it as a tool in my toolbox to use
Uh,
as needed.
ask you to pause. You've mentioned
Mhm.
mental health twice.
Mhm.
W Are we talk well, depression and anxiety, thoughts of gloom and doom.
Yeah.
What does that look like for you?
I have told my husband quite a few times now that I will never be normal again.
I'm sorry.
Oh, quality of life. That's what it is. That's the term that I was looking for. My quality of life suffered because daily I'm thinking about, is something going to bulge into my vagina? Why am I feeling funny today? Can I exercise? Can I do my HIIT exercises that I did before having surgery? Will I ever be able to do those again? Am I going to have another surgery? I believe sometime in my future is a rectocele repair. The pelvic floor physical therapy helped a lot of things. It cannot fix the rectocele. I will always have the possibility of that bulging. And the pessary keeps things in place while the pessary is in there. So mentally, there are ups and downs in the recovery. I have learned to advocate for myself. If something is not right, I go to the doctor's office and I say, "What can I do?" Many times as women, we live with a condition, the stress incontinence that women suffer from after having children. We see commercials on TV for Poise Pad, for Depend. We are conditioned to be and told, "Oh, it's part of aging. It's part of what happens to our bodies as women." I am not going to let doctors tell me that
Great.
and leave it at that anymore. And one of the main reasons why I'm sharing my story is because I want other women to learn how to advocate for themselves and don't settle for the "it's part of aging, it's part of being a woman" answer.
It's great.
Yeah. Um, a couple of things that I've also, uh, had learned about in my recovery is estrogen. So at the beginning of my talk, I stated that I believe that there should have been some talk of estrogen before my surgery. The reason why I said that is because after my surgery, at my 6-week follow-up with my doctor, I said, "Okay," this was with my gynecologic oncologist. So with that, just know that he specializes in cancer. He does not specialize in menopause. Um, so
Is that
I,
something
you
you
know,
found
I
out
yes, I
during this
realized that
process again?
afterward.
Mhm.
Yes, yes, because I asked him, he removed everything. He removed my ovaries too. I said, "So, what about estrogen? When can I start? What should I do? What about hormone replacement therapy? Can you tell me about that?" And his answer was, "Oh, I just get something at Costco for my wife." And he looks to the nurse and he's like, "What is that I get her? What do I get her at Costco?" And then he's like, "Oh, I just get her Estrogen from Costco, and you can try that." And that was my answer for
Do you
what
think
to do.
the gender difference between yourself and the physician made a difference on how important he thought it was to address the need for estrogen supplement?
Yes, and
Mm.
also the education for doctors regarding menopause, which through a lot of research that I've done in the past year, most doctors are not educated in menopause and how much estrogen is needed by our bodies. Our bodies rely so much on estrogen. People think of menopause as hot flashes. Let's say hot flashes, night sweat, and it's so much more. I did not settle for that answer. I did go get estrogen so that I could start taking something right away,
Good for you.
but I made an appointment with my gynecologist, and my visit with her, I had not really developed a relationship with her yet. That visit, that after my hysterectomy, when I went back to her, was just a half hour telling her about my experience and her just telling me the options of estrogen. And it was just a half hour of talking and discussing. And that's when I really started to build a relationship with my gynecologist. Advocate for yourself. So, on that hysterectomy support group, there were women that were prescribed vaginal estrogen right after the hysterectomy to it helps strengthen the vagina and helps in healing. My doctor never offered that to me. I found that out later when I went to my gynecologist. Even if it is just telling women, "Go to your gynecologist and discuss this." He never even said that, He should have said, and this is just my opinion, I am not educated in that area. This is a discussion you should have with your gynecologist or a menopause specialist, because there are menopause specialists as well. And there's a group called the Menopause Society that you can look up online. You can find doctors that are more qualified for menopausal women. these are questions that you should ask when you're preparing for a hysterectomy. These are some considerations that you should take into account when you're deciding on a doctor for a hysterectomy.
What are some red flags for women when shopping, quote unquote, for the right physician?
Follow your gut. If your questions are not getting answered, if there's avoidance of your questions being answered, then that doctor does not have the knowledge or the training maybe for your full follow-up care, for counseling you before and after. Ask questions, lots of questions. Look up online. Maybe there are lists somewhere that people have made about questions. There is a doctor that I follow now that has a menopause guide and questions to ask your doctor when you go in to discuss menopause. So maybe someone has made a guide, questions to ask your doctor when you're going in for a hysterectomy. That's not something I looked up. Look it up. It may be there. But yes, if it was a red flag for me when I asked about my ovaries, and he's like, I guess, yeah, your ovaries are still giving off a little estrogen at your age. I was kind of shocked at that answer, but I didn't know
Absolutely.
what other choice I had
Mhm.
for a gynecologic oncologist. I'm in a suburban area. There were a few for me to choose from. This one was when I called my gynecologist's office and I listed off the ones that accepted my insurance. They said, "Oh, we have a relationship with this doctor. So we do recommend that you go to this doctor."
And you mentioned health insurance because the entire time you're talking about these issues and having to go back and continuing to try and plug the holes in the boat to keep from sinking. I'm wondering,
Mhm.
how was the health insurance during this time? Did it become expensive for you? Do you have great coverage?
My coverage at that time is different than what I have now. And with I've changed jobs since then, and with my job change, I actually researched a lot of different health cares. I became a government employee, and government employees have lots of options. So I researched to understand. My healthcare insurance at that time, I paid a lot monthly. My employer did pay a percentage, but I was paying about $200 per paycheck. It was a good plan other than that because I had a $500 deductible for the year, and then after that, I had co-payments for doctor's appointments. But for my surgery, once I met my $500 deductible, which I'd met before I went in for that surgery, I had 0 out of pocket for my surgery while paying $200 per paycheck for my
Mhm.
insurance premium. But you can look at it as that is paying it out over a year's time, what the
True.
cost of my surgery would be. But I also had a 5-night stay, 10 days later because of the hematoma. I had an overnight stay for my hysterectomy because actually I had low blood pressure, and when they tried to get me up to walk, I fainted, and that was an automatic, "Oops, you're staying overnight." But that 5-night stay afterwards for the hematoma, I still had nothing out of pocket. So my insurance actually was did very well for me because my total health bill for that year was probably close to $20,000 if I had not had insurance. I had insurance. For some people, insurance has a co-insurance where you don't have co-payments for each thing. You have co-insurance that you have to pay after you meet your deductible. This is very important for people to research. I'll just say this very briefly because I researched it a lot. Um, if you are at a point in your life where you may have surgery, you're older, you have children who may break a bone, whatever, you need to make sure that you look at that coinsurance. If you have a 20% coinsurance, if anything happens, you go to the hospital, you have to pay 20% of that bill. All of the government insurances have coinsurance except for very high premium ones. I found one that had a high deductible, but then only 5% coinsurance. So after I meet my deductible, I'm only paying 5% coinsurance. So I did have 6 months of visits to physical therapy. I had met my deductible instead of like $20 copayments. My cost was $4 per visit to the physical therapist because I had a 5% coinsurance. So researching your choices for health insurance is very important.
Yeah. It's great for you that the health insurance worked out. Flip side, this makes me mortified for people of lower economic status. Um,
Mhm. I can take a moment just to discuss where I am now, 15 months post-op. My fitness level is back to where I was before my hysterectomy. It took months before I was feeling fit again. My exercise program has changed. As a postmenopausal woman, you need to have a different type of exercise program, and I've researched that. However, I have gained 10 pounds since my surgery, and that is very frustrating. I have researched nutrition, anti-inflammatory foods, how much protein a postmenopausal woman should intake, how collagen affects. I've researched so many different things. I was a clean eater before. I'm now even cleaner, but I have 10 pounds that have just appeared, and my belly is different than it was before. So there are definitely changes to a body after surgery and after menopause. Being on estrogen now, there were things that I realized that I was suffering from before. I suffered from major brain fog, and I didn't even realize it. Brain fog is when you cannot find the words when you're discussing things. I was having long pauses when I would talk to people sometimes. And in my brain, I was going, why can't I find the words that I want right now? Why am I pausing like this? I did not know there was such a thing as brain fog.
so
Didn't
that
know.
was happening to me, although I haven't had a hysterectomy. Jeez. Sometimes I can
Um,
barely get my words out, and this is with no procedure.
so brain fog can start occurring, menopausal symptoms can start occurring in your late 30s and in your 40s, perimenopausal symptoms. And brain fog is one of them. Since I've been on estrogen, after I got on estrogen, that disappeared. And I could not believe the difference. I had no idea I was suffering from brain fog. That was the
Great.
reason for my surgery. Precancerous cells, I did not have a choice on my hysterectomy. It was get a hysterectomy or be diagnosed with cancer very soon. Even though my cervix is gone, I still need an annual vaginal swab, which I just had a couple of weeks ago, and it came back clear. Pe-
Great.
Some people think that, oh, well, your cervix is gone. You don't have to have pap smears anymore. No, you still do. You still have to monitor your vaginal health.
You were
Um,
a newlyweds during this period, close to it.
yes, yes.
Can women be best supported during this? You were elated to have such a wonderful, supportive husband. What can men do to support their loved one during this time?
That's That's an excellent question because on that hysterectomy support group, I've seen some women that did not get the support that they need, that had men saying, "Your hysterectomy was 2 weeks ago. Why can't you get up and vacuum today?" Or, "Why aren't you cooking for us again?" Rather than having them say, "Honey, your body needs to heal. You do what you need to do to heal, and I will take care of you." I got married during this whole time. I had a new boyfriend at the time when I first was had my abnormal pap smear. We eventually moved in together. I'm diagnosed, getting ready for a hysterectomy. He submits to his company for FMLA leave, family medical leave. He works for a large company. We were not married yet, and I knew I would need him. The downtime, you're told to take at least 2 weeks off from work. Some people take 4 to 6 weeks off of
Mm.
work for hysterectomy recovery, and you need someone there with you. I had a station set up. I had everything that I needed. I was on my reclining sofa for weeks because you cannot lay down flat. It's hard to get up. You want to be walking. You need a lot of support. So he put in for the FMLA. It was denied because they did not recognize a domestic partner for FMLA leave.
That's a policy
When he
issue,
got,
isn't it?
yes, yes, we were committed to each other, domestic partners. We didn't see the need for a piece of paper saying that we were married at the time, but I knew that I needed him to be with me afterwards. I knew I needed support. So then I'm like, okay, what are we going to do now? Well, little did I know he had already decided several weeks earlier that he was going to propose to me. And when he got that email, read that email, we were in the living room. He went on his phone and then he got down on one knee and he had a
Get
picture of a
out of
ring and
here.
he proposed to me. Yes.
How is that for in
And
sickness
he,
and
pro-
in health before you have to say in sickness and in health? Good for you. No wonder
yes,
you were so
yes.
excited. Now have more insight. Good for you. Congratulations. That is beautiful.
He proposed and 5 days later we went to the courthouse and got married. And that was 2 weeks before my surgery. He resubmitted for the FMLA and was approved and was able to be with me, which I needed him because and his company gave him 6 weeks if needed. And it was needed because I went back into the hospital for 5 days and had the hematoma, which I had a drain coming out of my butt cheek for 23 days to drain the blood from that hematoma, and I had a drain bag attached to my thigh, and he had to learn how to empty the drain bag and treat the site where the drain was going into me. So, he was wonderfully supportive. It takes time. So, any partner that has someone going to have a hysterectomy needs to be patient
Mm.
and supportive and not saying, "Why aren't you better now? Why can't you do this now? You've had time. Let's get up. Come on. What are you doing?"
Mhm.
No, you have no idea how much it takes for your body to heal and how long it takes.
Words of encouragement.
Words of encouragement. Find what you love in life to have something to look forward to every day. Advocate for yourself. Research. Learn what questions you need to ask. so that you can improve your quality of life. Do not let people tell you it's part of being a woman or it's part of getting older. And don't give up. There are people in your life that are counting on you, that want you around, but also those people that will support you and help you. Don't hold it in.
It's great.
A lot of times people are like, I can handle it. I can take care of it all by myself. That will really wear you down.
Mm,
Talk about it. Let people know what you're going through. Be transparent about the struggle.
That's awesome. Thank you for that. Anything else you want to add? You've been so descriptive and transparent. You will bless people, and it shows
Mm.
just how much this has affected your life. So I can't thank you enough.
I appreciate the forum that you've given me and others to share their medical journeys because I believe it is needed and I hope that people get some kind of reassurance, some kind of information out of what I was able to share.